So we're going to get into our notes. And again, we're going to look at this expanded view of the ANS. Autonomics, of course, are a very subpart, but a very critical part of the total nervous system. And we want to kind of look at it as a whole now, and so that you kind of have a nice clinical overview of the critical parts of this storyline that is important for you. Now, the notes start off here. It's some general organizational comments. You know this, so I'm not going to spend much time here. We've covered this last week various times. And we know that according to the nervous system as a whole, you can describe it in a structural way or an anatomical way or in a functional way. Now, anatomically, number one there, you certainly familiar with that. That's central and peripheral nervous system. You know that. That's standard material, standard pieces of information there. And don't forget, again, a reminder, in the peripheral nervous system, don't forget that includes ganglia. So don't let that slip by. And then from a functional standpoint of view, notice we have two subdivisions again. Of course, that's somatic and visceral. We talked about these last week. Somatic are those sensory or motor pathways, circuits, that allow us to have conscious knowledge of movement or conscious knowledge of sensory input. So these are somatic motor, of course, is just a voluntary control of skeletal muscles. And remember, we talked about that in the core, the upper and lower motor neurons, etc. That is the voluntary movement of the limbs, as we mentioned. And then, of course, there's perception of touch, vibration, deep pressure, and all of the other modalities of sensory that we're aware of. But then the flip side of that is where we're going today is the autonomic nervous system. And this is the visceral system, visceral pathways, visceral circuits, because these are the ones that are below conscious level. For the most part, they're outside of your realm of consciousness. They're going on 24/7, so to speak, and you don't have any consciousness or control over those at a conscious level. So notice this is the critical system we are going to expand on now, the autonomic. Now, a couple of things about autonomics here in that first paragraph you can read. Of course, it mentions the function of them. That's fairly obvious. It's maintaining correct balance of function, motor, and sensory here within our internal visceral systems. So it's kind of that homeostasis maintenance of all of those internal events. A couple other points you want to just quickly note there in that first paragraph. Notice that the ANS circuits are found in both central nervous system and peripheral. So it has a central and a peripheral extent to it. And again, notice like somatic, it's going to have motor and sensory fibers. So it's going to have afferent and efferent components as well. So it has some similarities to somatic and, of course, some major differences. Again, notice the autonomic functions are controlled by higher brain centers, and we mentioned this last week. One of those main ones is the hypothalamus, and we'll come back and kind of reinforce that a few pages over. So when you talk about the autonomic nervous system, you're going to be talking about a sensory side and a motor side. Now, here's a small discussion of the afferents, the sensory side of the system, and we're not going to deal with this much. The visceral afferents are there. They're very important. But for the most part, these are the circuits for this pathway is much less understood and described. And so we're not going to be dealing with the sensory side, and you'll find the exams will not either.